Thank you for the opportunity to share the impact that the Sparked Accelerator has had on our solutions at Telstra Health. Telstra Health solutions support a broad range of healthcare settings, from primary and aged care to pharmacy, hospitals, virtual care, and population health. But as anyone in healthcare knows, no system exists in isolation. Every system holds a piece of the patient story, and it's only by sharing those pieces that we can deliver truly connected care. Traditionally, every new implementation involves costly bespoke integrations. And you've probably heard the old saying, if you've seen one HL7 message, you've seen one HL7 message. And that's why Telstra Health sees FHIR as a real opportunity. But it's only an opportunity if we adopt it in collaboration with other solutions in the ecosystem. Without standardization, we risk repeating the same fragmentation that we saw with HL7 version 2. And this is where the Sparked FHIR Accelerator comes in. Not just a set of technical standards, but a national community of government, providers, clinicians, peak bodies, and vendors like ourselves working together to define a template for building interoperable solutions. And we think this is important because ultimately, the value of Sparked is about delivering what matters most: better care for patients. It allows people to tell their story once and have it follow them across their multiple care journeys. It allows them to receive the best care, which is supported by both timely and complete clinical information. Let's take a look at how Telstra Health has been adopting the Sparked FHIR Accelerator in its solutions. Our first example of information exchange is the common GP visit that results in a blood test referral. Today, this process is often paper-based or relies on custom integrations tied to a single pathology provider. Now, as a patient, I have been known to leave the clinic with a printed form. I head home, I put the form down, and after a few weeks, sometimes months, I've forgotten what I've done with that form. And typically, I'll have to call the GP practice and say, can you send me a replacement form, please? The AUE requesting standard starts putting in the key building blocks and putting those in place to improve on that experience. It defines how GPs can send electronic pathology requests directly to a nominated lab, a process known as an assigned order, and allowing them to retrieve the request electronically, automatically loading it into their system, which both reduces administrative effort and eliminates errors often due to mistakes made during manual re-entry. It's the first small step in a longer journey, but it has big implications for both clinical safety and efficiency. The diagram you can see on the screen describes the flow. The Smart Connect widget, which is part of Telstra Health's Smart Connected Care Suite, extends Medical Director Clinical, enabling a FHIR service request to be generated for the order. This is then sent to our Health Information Exchange and made available to downstream laboratories. I'd just like to run through a quick demo of how we've incorporated electronic ordering using the AUE requesting standard in Medical Director Clinical. In this demonstration, I'm using the non-production samples database. So picture a consultation with a patient named Angelina Clements. As the appointment progresses, her doctor decides it would be appropriate to order a blood test for further investigation. So she launches the pathology request portal and requests a couple of blood tests as she would normally do. For our demonstration, let's select an iron study, which we can search for manually and add that to the list, and also a thyroid hormone test. Now, on clicking print, the doctor is presented with a new dialog which allows her to create the digital order. We can see that all the information is pre-filled, such as the patient's demographics and the tests we've just selected. And the doctor has the option of making modifications to that, such as adding a new test, selecting the lab that the request is to be sent to, or maybe just adding a comment. In our case, no further changes are required and she can electronically sign and submit the order. And really, that's all that there is to it. The order is added to the clinical record with a minimal change to the GP's existing workflow. The request is sent to Telstra Health's HIE using the AUE requesting standard, and it's now available for the pathology lab to retrieve and ingested into their lab information system. This work is still in progress. We're currently engaging with both public and private pathology providers to deliver a solution that fully aligns with the AU requesting standard for assigned orders. And we've recently begun the discovery work for diagnostic imaging. We are looking forward to collaborating with the community on priorities like subscription notifications, unassigned orders that can be retrieved by any participating lab, and ultimately, we'd love to get to the place where we have consumer held orders that are accessible via QR code on their phone, giving patients both choice and convenience while still ensuring the safe and efficient processing of the order. In the aged care space, we've just started the journey with patient summaries. When a resident requires urgent medical attention, it would be nice if clinicians that are outside of the residential aged care facility were able to assess the urgency of their care based on their most recent clinical information. This information, along with their historical record, can be used to triage their case, potentially by telehealth, to determine if a visit to the emergency department is required. We are looking at exposing this information as an AU patient summary that external clinical teams can retrieve into their existing systems to support residents and aged care providers. Every day, clinical teams capture information about patients, residents, or participants in wellbeing programs. Yet often, the same information is recorded in slightly different ways across different systems, making it harder to compare or interpret results consistently. This lack of standardization creates barriers to delivering coordinated care and limits the usefulness of data in improving health outcomes. Smart on Fire apps offer a powerful interoperable solution. They are built on open healthcare standards and run seamlessly within the context of a clinical system, enabling consistent data capture, up-to-date clinical decision support, and easier adoption of evolving best practices. Our Helix practice management system natively supports Smart on Fire apps through its integration with Smile CDR, a leading Fire platform from our partner Smile Digital Health. We've adopted the AU core standard for Helix integration to ensure it meets the requirements of nationally developed assessment forms and their corresponding clinical decision support tools. We're in the discovery phase to determine how we include a similar capability inside our medical director clinical and communicare products, which will increase the availability of nationally developed assessment tools to health providers that use our products. We're looking forward to continuing our collaboration with the Spark community as we make good on our mission to realize a connected and improved digital health experience for all. Thank you.